Hello, and welcome to the first ever episode of KHNI Talks. I'm your host, Brian Short, Senior Consumer and Market Insight Specialist at Kerry. KHNI Talks is where science meets nutrition, and is brought to you by the Kerry Health and Nutrition Institute, KHNI, which was founded over 10 years ago and leans on the independent experts to deep dive into the science for healthier food. Today, we put ashwagandha under the microscope, exploring the science behind it, its health claims, as well as the regulation and misinformation which surrounds this adaptogen. To unpack this, I'm speaking online with Dr. Thomas Brentler, founder of consultancy Plantophile. Thomas is affiliated with academic organisations such as the University of Illinois, Southern Cross University, and the University of Johannesburg. And he's also the chair of the Botanical Dietary Supplements and Herbal Medicines Expert Committee at US Pharmacopoeia. Joining us here also in studio is Dr. Mukesh Saman, Global Director of Toxicology at Kerry. You're both very welcome to Ashwagandha Under the Microscope. And maybe, Thomas, to come to you first, you're very welcome onto the podcast. And we understand you've been busy reviewing the latest evidence on ashwagandha. Perhaps with that in mind, you could start with a quick introduction to yourself then as well.
Absolutely, yes. So I've been an industry consultant and scientist in the field of botanical products for over 30 years. My focus is really on regulatory affairs, but I've pretty much worked in all segments of this industry, all the way from supply chain, bringing new ingredients to market, formulation, claim substantiation, etc., etc.
Okay, so Thomas, we're here today to discuss ashwagandha, and for listeners who may not be familiar with ashwagandha and its adaptogenic benefits, how would you describe it, and maybe why would someone use it?
Yes, absolutely. Ashwagandha is an ingredient that's been used heavily in mostly Indian traditional medicine, Ayurveda. It's considered a rasanaya or a rejuvenator. In more technical terms, what we call this these days is an adaptogen. And adaptogens basically help the human body to respond to stress and to become more resilient to stress. And what's unique about that is that whatever an adaptogen regulates in, be it your physiology or your mental state, it will always remain in what we call a normal clinical range. It means if something is wrong with you, it needs to be upregulated, it will upregulate. If something is too high, it will be downregulated. That's basically the function of what ashwagandha does in so many different areas. So ashwagandha is traditionally used and also clinically studied for things like stress response, hormonal imbalances, endurance, sleep, etc., etc. So it has a very broad range of application.
Thanks so much, Thomas. We know each other quite well, Mukesh, but could I ask you to give the audience a quick overview of your career before and during your time at Kerry?
Yes, of course. Hi, everybody. I'm Mukesh Saman. I'm the Global Director of Toxicology for Active Health and Nutrition for Kerry. Prior to joining Kerry, I was at the FDA and I spent 15 years there. I started off as a toxicology reviewer in the endocrine division and then moved through the ranks as a supervisory toxicologist and then as a division director, where I oversaw the rare diseases, pediatrics, and reproductive health divisions. I joined Kerry in 2023. And my role now is to provide a safety assessment for Kerry's ingredients, including those ingredients that go into food, beverages, and supplements.
Thanks so much, Mukesh. Maybe to stick with you on this, Mukesh, in terms of the health market, it can sometimes feel overcrowded and be daunting for consumers to really decide what supplements, if any, they should add to their diet. So maybe in terms of the science behind ashwagandha, what are its real-world benefits then as well?
So ashwagandha is a botanical with a 3,000-year history in traditional Indian medicine. Numerous randomized clinical trials, which are the gold standard of measuring a treatment's effectiveness, have been completed, including those clinical trials completed by Kerry. Our root and leaf extracts have shown, like many of the other supplements, that ashwagandha is safe to take. In addition, the health benefits are incredible. It has been used and researched by many investigators and shown to enhance sleep quality, reduce stress and anxiety, and also boost women's health.
Okay, brilliant. Yeah, and we might get into that as we go through the podcast then as well. Thomas, coming to you, and we understand you've been working on a special edition of the Phytotherapy Research Journal. It's fully dedicated to ashwagandha. And I suppose just around that, maybe give us an insight into why maybe you felt that ashwagandha merited its own special edition.
Yeah, with pleasure. It's a little bit of a longer story because Ashwagandha was first scrutinized over its safety as far back as 2013. And that investigation was conducted by the German Institute for Risk Mitigation, and nothing much came of it. But as of recently, national competent authorities, especially in the food segment all over Europe, have been taking up those concerns and taken some regulatory action. It varies from member state to member state. And it felt like uh, the best way of addressing these concerns was by giving regulators a well-curated set of data. And this is what this special issue is about. So we basically looked at the list of what the concerns were. I brought together a little team of experts myself, but we also invited contributions from academia, from industry, essentially from everybody who is a stakeholder in this ingredient, if you will. So the idea was to basically bring together a well-curated data set that would enable regulators to make informed decisions about the future of ashwagandha.
Excellent. Okay, really appreciate it. So it's all around informing those policy makers and really getting into that. And
Yeah.
I suppose if that's the why, can you help us understand, in terms of the what has come out of the full year that you've dedicated to researching the science of ashwagandha? And I know you very publicly have spoke at the meeting of Society for Medical Plant and Natural Product Research in September. So maybe just share your thoughts or bring us into that if you could, please.
Let me once again go back to what the concerns were, because that makes it much easier to relate them to what we found. One of the primary concerns, and remember, we're looking at like 13 years ago. There really wasn't that much evidence available, especially not as much as it is now. So the primary and baseline concern of competent authorities at the time was we don't really know what a safe dose is. We don't really know what a safe duration of consumption is. And therefore, whatever activity this ingredient might have is a potential safety issue. So this is exactly what we try to address. So we looked at the preclinical evidence. We looked at the clinical evidence. We looked at particular concerns, be it hepatotoxicity cases, be it thyrotoxicosis cases, be it case reports of other adverse events, try to contextualize them and bring them together to form a coherent picture of what we're dealing with. And so what we found, first of all, ashwagandha is apparently safe to take at doses of up to 3, 4, 5 grams per day raw material equivalents over longer periods of time, 90 days and longer. This is all evidence derived from clinical investigations. And we also looked at the adverse event reports, etc., and did not find an awful lot of evidence that proves, or that comes with proven causality, I should say. So we have to take these cases seriously. I'm not brushing anything under the table here, but more research is needed in order to look further into the causality of those adverse events. Overall, however, I must point out that what we found also in the various effects that ashwagandha has, and I mentioned that earlier, it acts like a proper adaptogen. Whatever happens stays within the normal range of clinical outcomes or in a normal clinical range of parameters. So we did not see any spikes that would or should be considered a potential safety issue.
Okay, thanks so much, Thomas, and we really look forward to the publication of that journal when it does become published as well. So thanks so much.
Yeah, I should maybe say that these papers will be published gradually, but if you just watch that space over the next couple of months, we'll be looking at a set of probably close to 20 papers that all address the various issues of ashwagandha safety.
Absolutely, and maybe to just give the listeners a bit of direction in terms of where they might find this evidence or information, could you just give us a
So the journal is Phytotherapy Research, and all these publications are combined in a special issue concerned with ashwagandha safety.
Excellent. Thanks so much, Thomas. Mukesh, you mentioned around potential benefits for women in particular. Could you give us a bit more on that in terms of, and we do see this in the market from consumer-facing messaging as well. Why is this messaging present in the market then as well?
Yes, you're absolutely right. In recent years, there has been growing interest in the potential health benefits of ashwagandha. Among uses for women include stress management, hormone balance, and also the relief of menopausal symptoms. Kerry's recent publication in the Journal of Menopausal Medicine is a good example of this. We used a root and leaf extract of ashwagandha, and it was shown to relieve menopausal symptoms such as hot flashes, night sweats, and sweating by 20%. Our other studies have also shown benefits in reducing anxiety and stress. So these are real-world examples of the health benefits of ashwagandha.
Absolutely, really appreciate that. And you mentioned around, root and leaf solutions, and maybe Thomas, to bring you back in here. A lot of solutions on the market use both root and leaf of the ashwagandha plant into supplements. Particularly, is the ashwagandha leaf safe to use, and what benefits maybe does it deliver as well?
I didn't find any evidence to the contrary, let's put it this way. And we looked at evidence from more than 100 clinical trials that were published over the last 40 years. I want to say about 25% of those are probably looking into this efficacy and safety of leaf or leaf and root products. And we did not see any difference in efficacy or safety parameter reporting whatsoever.
Okay, and that's in terms of the ashwagandha's leaf's safety. But in terms of its benefits, Thomas, could you give us an insight into that, please?
Yeah, I mean, both root and leaf have been studied for similar, if not the same, effects. And what we found is that there is no obvious difference in either efficacy or safety of root products or leaf products or combinations of root and leaf.
Thanks so much. Really appreciate it. And then in terms of, we've got into the safety around ashwagandha and Mukesh, but in terms of to really kind of deep dive into that, there has been circumstantial case reports of, linking ashwagandha to liver injury for one issue of that. Does the scientific evidence show that ashwagandha poses a risk to general population? And maybe can you help us quantify that risk then as well?
Yeah, so ashwagandha is rooted in Ayurveda, and ashwagandha is safe for most people. We have applied modern science, and our root and leaf extract has been studied in human clinical trials, and we have not seen any adverse events. And these are trials where we actually measured liver function and liver enzymes, and we saw no impact. In addition, other researchers have done meta-analyses of the clinical trials and looked for evidence of liver injury and found none. In addition, health authorities such as Australia and the Netherlands have also weighed in on this issue, and they have determined that liver injury is a rare event. Importantly, they have not moved to ban ashwagandha.
Okay, brilliant. Thanks so much, Mukesh. And Thomas, another issue that commonly is discussed within the industry is linking ashwagandha to abortion. And it's regularly dismissed by the scientific community. But could you just let us inform us, I suppose, in terms of any evidence to support such claims around ashwagandha and abortion?
Yeah, this is an interesting one, and actually a rather sad case that I see more and more examples of in the scientific literature, and that is that of creating modern myths by miscitation, circular citation, folks not going deep enough into the literature when they write their own papers and cite evidence. So what we're looking at here really comes down to some 1861 hearsay, because that is the original source of this quote-unquote evidence. And unfortunately, it's been carried through the literature somewhat innocently or unscrupulously. You can call it whatever you want, but the result is that we now have to deal with effectively false evidence. there is absolutely no evidence for ashwagandha acting abortifacient or abortive. To the contrary, there is good scientific evidence that it doesn't. All that said, it becomes extremely difficult to remove something like this from the scientific canon once it's gotten a foothold, and we'll probably be dealing with this false information popping up in the literature for a long time until it's properly eradicated.
Okay, brilliant. So that's it, I suppose, in terms of the safety concerns, we've got into that. And I suppose back to the point that because ashwagandha and botanicals like it have been safely used for over thousands of years, many regulators have only really now started to bring this botanical under some sort of regulatory framework. And Mukesh, I know you mentioned Netherlands and Australia, but can you give us a broader overview, I guess, of the countries who have really deep dived into the use of ashwagandha then too?
Yeah, so the regulatory status of ashwagandha varies by different regions across the world. For example, in Europe, there is, harmonized regulations. However, each member state may implement these regulations differently. So, for example, an ashwagandha botanical in one country may be a food supplement, but in other countries, it may be regulated as a herbal medicinal product. So there's a lot of differences about the regulations all over the world. Kerry's root and leaf product is backed up by 15 human clinical trials, and these have been reviewed by various health agencies throughout the world. And this means that the product is marketed safely in many countries all around the world. For example, in Canada, it is a natural health product with health claims. And these health claims are such things as reducing stress, anxiety, sleeplessness, and also irritability or ability to concentrate. So you can see, depending on the country, there may be health claims associated with the product, or in other countries, they may be regulated as a food supplement. It does really vary across all regions across the world.
Okay, really interesting. And especially when you see the diversity of opinion from policy and regulators coming into it. And I think that's, again, back to your point, Thomas, in terms of why it's so important to have that trusted body of evidence and that science behind the safety and the use of it. So given the body of evidence that we now have, Thomas, and especially with this special edition that you've mentioned, do you feel more generally should ashwagandha be banned?
No, I don't think so. I think we have a good baseline data set that demonstrates safety of use for ashwagandha, that demonstrates what a safe daily dose can be, that demonstrates what a safe duration of consumption can be, that demonstrates that all the efficacies that we're seeing in the clinical trials remain within clinical range. So I think this is, to the contrary, a very good basis for ashwagandha not to be banned.
Excellent. Thanks so much, Thomas. Really, really appreciate your perspective on that one. And Mukesh, are you aligned to that? Are you in agreement with Thomas is saying here, or anything to the contrary?
Yes, I absolutely agree with Dr. Brentler. There is a whole body of evidence, numerous clinical trials, including clinical trials with root and leaf, which have shown us that ashwagandha products and supplements are safe to take. So I think it's absolutely critical that the regulatory health authorities review that data and draw their conclusions and give evidence to the wider public and let them know that ashwagandha products are safe.
I should add, however, that it is just as important to continue research because we need to take the adverse events that we have seen seriously and elucidate the causality, or if there is any causality at all. So at the same time, I consider continued research into efficacy and safety of ashwagandha pertinent.
And to build on that, Kerry is absolutely dedicated to the science. We're heavily invested in producing good quality products to make sure that they are safe for the consumer.
Okay, brilliant. Yeah, no, really, really makes sense. And I suppose in terms of, and we are coming up to time, so maybe to kind of close us out with one final question. Mukesh, coming to you first, in an ideal world, what would you like to see put in place around ashwagandha, given the conversation we've had here this morning?
Sure. In today's fast-paced world, people are seeking natural, effective solutions like ashwagandha, but consumers may not have a good understanding of what constitutes a high-quality product. That is why at Kerry we have branded products. It gives the customer full transparency about the science, the safety, and the quality of the ingredients. And that is why at Kerry, we are vested in the science to provide the best product for our products so that consumers have good quality ingredients.
Okay, brilliant. And Thomas, coming to you in terms of how would you build on that, maybe from your angle as the independent expert contributing to Kerry's Health and Nutrition Institute then as well?
Yeah, and I would really just like to see more collaboration between industry and regulators. I think this is a huge opportunity, both for the manufacturer of be it supplements or medicines, to strengthen their position, and with that also to strengthen the messaging around the safety and efficacy of their products. On the other hand, as I already said, regulators need to be well informed. So there needs to be a dialogue. There needs to be communication going on. Hey, we don't know enough about your product. Can you give us better information so that we can make better decisions? So if this would come together more organically, I think we'd have a much better baseline situation for bringing new products to market.
Okay. So from listening to both of those answers, I think it's clear from a bottom up level, the consumer needs to be supported on that journey of what supplements they're going to purchase, making sure that there's real science behind them, and then from that top down angle, Thomas, you're mentioning around government and regulators coming in.
Yeah, I mean, both parties have an obligation in that, both the manufacturer and the regulator. The regulator is responsible for consumer safety. The manufacturer is responsible to give the consumer quality products. And if that comes together in a dialogue between actually all three parties, I think then we have the best of possible worlds.
Okay. I really want to thank our guests, Dr. Thomas Brentler and Dr. Mukesh Saman, and thank you for listening. I suppose it's really clear to see some of the challenges within the industry surrounding ashwagandha from a policy point of view in terms of getting that leading research. And I suppose that opens up a huge amount of opportunity then for researchers such as Thomas and companies such as Kerry to progress this science and to inform our regulators and to inform consumers of the science behind ashwagandha and why it's so safe to use. Please subscribe to KHNI Talks and visit khni.kerry.com to understand the science behind some of the most challenging questions facing the nutrition industry today. This has been KHNI Talks, Ashwagandha Under the Microscope, where science meets nutrition. Thank you.